Yes, they can. How dementia is diagnosed is a little different. It's not just a simple blood test. They're working on it, but they haven't got those tests yet. So if a person is concerned with dementia, they would go to their family doctor and talk to their family doctor. The family doctor would first want to make sure that there's nothing medical going on. So they would, because a lot of things look like dementia and they may not be dementia. So the doctor would want to do, the full physical blood work, blood pressure, all of those types of testing. And they would probably administer what we call a mini mental status test, or the MOCA, which is the Montreal Cognitive Screening Test. We've heard a little bit about that in the media lately with Donald Trump talking about, what was it, woman, fish, whatever camera, TV, whatever those 5 things were. But the MOCA test and the mini mental status test can be administered by the family doctor. They're going to ask you sort of why you think you have dementia, why you think you need to be concerned. And then if the family doctor wants to, or if he feels there's a warrant for it, he'll refer you on to a geriatrician or a neurologist for further testing. I know here in York Region and in North York, there's the Toronto Memory Clinic, which is out of North York. Generalist Dr. Sharon Cohen. She's one of the very few research sites in Canada that will take people in, and even if you do not have dementia, you may be qualified for some sort of research program or protocol. So it is a medical exam that has to be done, and it's called a clinical diagnosis because they do a number of things in terms of how, they look at the medical, but then they do the psychological testing and questions and answers. You may have to get a MRI or a CAT scan as well as part of the protocol.
Get screened like a physical for dementia?
That's a good question. It is something that has become more common as you get older. So when we look at people, there's all sorts of talk out there in the community about, as we do colorectal screening, we do breast cancer screening, maybe we should be doing some sort of a cognitive screening at 65 or 60. It is something, but it's very controversial. So it is something that has not moved very far. But I would say, if you are in your 60s or in your 70s and you have noticed a change in your cognitive functioning, please talk to your doctor, because there are things that can be done. There may be some medications that it could slow things down for you if you do have a dementia. If you do not have a dementia, maybe they'll uncover that it's depression or that it's a thyroid problem or something else that can be corrected easily. So to answer your question, sadly, there isn't a screener, but it is something that I would keep an eye on. It's part of your health, right? And it is something that increases with age. So, 1 in 10, 1 in 11 over the age of 65. As we get into our 70s, it's probably 2 or 3 out of 10. And as we get into our 80s, it's maybe 4 or 5 out of 10 will develop dementia.